Buckwalter, and I'm here to talk about Chaddock's Intensive in-home program, and I'm here with Marcia Ryan, who also works on the intensive. And first, just real quickly, what an intensive is, basically we are going into the home and we're working with a family anywhere from one-time home visit, 2 days, 3 days, up to 5 days. So there's several different levels of how we're doing the intensive with families depending on need. And there's lots of different cases that would be appropriate. You want to share?
The ones for the shorter ones, or maybe it's just the parents are insecure and they might just need a little extra skills, kind of a little boost in what's going on in the home. To families that the child isn't as severe that they might need residential, but their parents are struggling with managing the day-to-day behaviors of the child. And based on the intensity of the child and the work that the family needs to do, will really depend on how long we would be in the home.
Mm-hmm. And I think one of the benefits of our team is between Marcia and myself, we're trained in a lot of different clinical models. In the intensive, we will employ TheraPlay, aspects of dyadic developmental psychotherapy, trauma-focused cognitive behavioral therapy are a few. Marcia?
We also do TBRI, which stands for Trust-Based Relational Interventions, as well as from the ALERT program, we work through the Engines curriculum. So, those are just kind of the basics of what we do, looking at the sensory needs of the child, providing some suggestions in that area.
We also use quite a bit of video. We do a videotaped assessment of the parent and child together, and then we also use video intervention where families make a video of their family together and we can provide some feedback based on the interactions that we see.
And EMDR as well.
Mm-hmm. Yep. And so some people might wonder why an intensive? And what we have found is that doing these multiple days and multiple hours has a great impact as opposed to maybe weekly therapy, and really have seen some success. So we're looking at something in between weekly therapy, but not such an extreme intervention as placing in residential treatment, something in the middle. And Marcia and I each have separate roles. I am the therapist or clinician for the program, and if you want to share your role, Marcia?
Mine is more kind of the hands-on work with the parent, the coach from behind, my opposite suggestions, as well as, I do the work with the children, where I might play and show them how to, as an adult, play with the child. So kind of what I do.
Yeah, so feel free to contact me, Karen Buckwalter at Chaddock.